Hey everyone, welcome to Snooze Central. Today, we're going over the causes, symptoms, and treatments for sleep apnea. Be sure to watch until the end because we've got everything you need to know about sleep apnea. Before we get into the video, make sure to check out the link in the description for the best method to stop snoring. Now let's get straight into the video. What is sleep apnea? Sleep apnea is a relatively common sleep disorder that causes breathing interruptions during sleep. These interruptions, known as apneas, can last from a few seconds to minutes and may occur 30 times or more an hour. Essentially, sleep apnea is a serious condition where the breathing stops and starts repeatedly, disrupting sleep and impacting overall health. There are three main types of sleep apnea, each with distinct characteristics. The most common type is obstructive sleep apnea, OSA. This occurs when the muscles in the throat relax excessively during sleep, causing the airway to collapse and block airflow. It's like trying to sip a drink through a straw that keeps bending. Not much air gets through when the pathway is blocked. The second type is central sleep apnea, CSA, which is less about physical obstructions and more about communication problems. In CSA, the brain fails to send the proper signals to the muscles that control breathing. This type is like having a faulty signal in a traffic system. Even if the roads are clear, if the signals aren't going through properly, movement stops. The third and least common type is complex sleep apnea syndrome, also known as treatment-emergent central sleep apnea. This occurs when someone has both obstructive and central sleep apnea. It's like facing both a blocked path and a faulty signal. Double trouble, making effective treatment more challenging. Understanding the type of sleep apnea is crucial because it influences the treatment approach. Each type has different implications for the person's health and requires different strategies to manage effectively. So it's not just about noticing that someone stops breathing in their sleep. It's about understanding why it happens and how to address it effectively to ensure a good night's rest and overall health improvement. Causes of sleep apnea. When it comes to sleep apnea, several factors can throw a wrench in the works, making it difficult for you to breathe smoothly while you sleep. Some of these causes are due to physical characteristics, while others relate to lifestyle choices or underlying health conditions. First off, anatomical factors play a big role. For instance, having enlarged tonsils or adenoids can crowd your airway, much like how a packed bus leaves little room to move. Similarly, obesity is a major player. Excess fat around the neck can squeeze the airway, making it narrower. Other physical traits such as a recessed chin, a narrow throat, or a deviated septum can also make it tougher to keep the air flowing smoothly while you sleep. Genetics can also cause sleep apnea. If your family has a history of sleep apnea, your own risk might be higher. Lifestyle factors are another crucial piece of the puzzle. Alcohol and sedatives, for example, relax the muscles in your throat, which can lead to collapses of the airway during sleep. Smoking inflames and swells the airway, making it smaller and more likely to obstruct. Even your sleep position can influence your breathing. Lying on your back, for instance, allows gravity to pull your tongue and soft tissues back, potentially blocking the airway. Additionally, sleep apnea often walks hand in hand with other medical conditions. People with diabetes, hypertension, or heart disorders are more prone to the disorder. Even hormone disorders like hypothyroidism or growth hormone excess can make matters worse. Understanding the causes of sleep apnea can be a big step toward getting better sleep. Identifying what specifically is causing your sleep apnea is essential because it directs the course of treatment, ensuring it's tailored to your specific situation. Symptoms of sleep apnea. Spotting sleep apnea isn't always straightforward, especially since the most obvious symptoms occur when you're sleeping. However, knowing what to look for can still be important, both for your sleep quality and your overall health. The hallmark symptom of sleep apnea is loud, chronic snoring. It's not just any snoring. We're talking about the kind that could wake up the neighbors. But it's not just the volume that's a giveaway, it's also the pattern. Snoring caused by sleep apnea tends to be punctuated by silences. These are the moments when breathing stops, followed by gasps or choking sounds as breathing starts again. It's like your body suddenly remembers it needs to breathe. Besides the snoring, sleep apnea can manifest in less obvious ways during your waking hours. Ever feel like you can't make it through the day without napping? Excessive daytime sleepiness is a big red flag. It's not just about feeling a little tired, it's about struggling to stay awake during activities like reading or watching TV. This kind of fatigue can stem from the poor sleep quality and frequent awakenings caused by sleep apnea. Other daytime symptoms include difficulty concentrating, mood changes like irritability or depression, and even morning headaches. The headaches happen because all those breathing interruptions reduce oxygen levels, causing blood vessels to widen. And it doesn't stop there. Over time, untreated sleep apnea can lead to more serious health issues. High blood pressure, heart disease, type 2 diabetes, and liver problems are all possible. These aren't just hypotheticals, they're well-documented risks linked to the strain that recurrent oxygen drops and sleep disruption put on your body. Recognizing these symptoms is crucial. They not only disrupt life quality, but also pose significant health risks if left unchecked. Knowing what to look for is the first step toward getting help and heading back to dreamland smoothly. Diagnosing sleep apnea. Diagnosing sleep apnea involves a few smart steps that can pinpoint whether you're just a loud snorer or if there's something more serious at play. The journey often starts with a visit to your doctor, where you'll discuss your symptoms and medical history. Your doctor will be looking for clues in your sleep habits and lifestyle that might suggest sleep apnea. They'll ask about your snoring, how you feel during the day, and whether you wake up gasping or choking at night. Next up, your doctor might suggest a physical examination, particularly focusing on the throat, neck, and nasal passages. They will check for any structural issues that might be causing breathing blockages while you sleep. But the real gold standard for diagnosing sleep apnea is a sleep study known as polysomnography. You'll spend the night in a sleep center, hooked up to equipment that monitors your brainwaves, blood oxygen level, heart rate, breathing, and even eye and leg movements. For those a bit wary of spending the night in an unfamiliar place, there's an alternative, a home sleep apnea test. It's a more simplified version you can do in your own bed. This test mainly tracks your airflow, breathing patterns, and oxygen levels. It's less comprehensive, but still a good starting point for some. Getting a proper diagnosis is crucial because it sets the stage for effective treatment. It's not just about improving your sleep, it's about warding off those other nasty health issues that can tag along with sleep apnea. Think of it as not only improving your nightly rest, but also protecting your overall health down the road. Before we get into the treatments for sleep apnea, make sure to check out the link in the description for the best method to stop snoring. Now let's get into the treatments. Treatment options for sleep apnea. Once you've been diagnosed with sleep apnea, the next step is figuring out how to tackle it. There's no one-size-fits-all solution, but there's a good mix of strategies that can help you breathe easier at night. One of the first recommendations might be lifestyle changes. If you're carrying extra weight, losing even a little can make a big difference. Fat around the neck squeezes the airway, making it harder to keep it open during sleep. Then there's smoking and alcohol. Cutting back or quitting can reduce inflammation and help keep those airways clear. For many, the go-to treatment is using a CPAP machine, continuous positive airway pressure. This device pumps air into your nose or mouth through a mask while you sleep, keeping your airways open. It's like having a gentle breeze constantly blowing through a tunnel to keep it from collapsing. If CPAP sounds like too much gear for your liking, another option could be a dental appliance. These fit into your mouth like a sports mouthguard and help advance your jaw slightly, making more space behind the tongue. It's a less intrusive way to keep the airway open. For those with more severe cases or where other treatments haven't worked, surgery might be on the table. Procedures can range from removing tonsils to more complex surgeries like jaw repositioning. These aren't first-line treatments, but they can be effective for the right person. Emerging treatments are also making waves. New devices that stimulate the nerve-controlling tongue movement have shown promise. It's like having a pacemaker for your tongue, keeping it in check so it doesn't block your breathing. Choosing the right treatment depends on factors like the severity of your sleep apnea, your overall health, and your personal preferences. It's a collaborative effort between you and your doctor to find the best fit, ensuring you get the restful sleep you need without any disruptions. Be sure to subscribe and turn on notifications so you don't miss more videos about sleep. Check out this video here, and I'll see you in the next one.